All right. Dr. Emer, we are live.
Hey guys, it's Dr. Emer. We're ending the night here in Manhattan, and I want to introduce something new to you guys. You may have heard of it from me and some of the other people online, very few, having Alo Clay. This is the newest large volume cadaver grafting that we're using to stimulate fat and build volume in areas that are volume depleted. And if you don't want to have a big surgery or you don't have fat that you can remove to do certain things like we're doing today, which is muscular contouring. We have a patient who's done some work with us before. He's basically Superman now. I mean, literally amazing results. But look at his bicep here. He just didn't have that big head of the bicep. His shoulders were always built. His triceps were, even look at his chest now. You guys can see, look, I'm going to show you here. Take a look there. Flex the bicep a little bit so people can see. Look, we're working to build that volume. Let me show you guys here. Look, so much bigger with Alo Clay. Go ahead and relax now. I am using Alo Clay in the subcutaneous and subdermal fascias planes to build volume here. Okay. And so this is going to not only be regenerative, you guys can see, look, we are injecting this as a scaffold, and this scaffold causes muscular growth, regeneration. I have had patients where literally their um, joint pains, their muscular pains, the chronic pains that they've had in their muscle or their joints have gone away. We've used this with other fillers. We've used this with fat to help the fat survive. Now we're doing in office muscular contouring with him because one of the areas that bothers him is his biceps. These areas have been very difficult for him to grow, and he has used some fillers, some fat to stimulate those areas. I'm going to show you guys really quickly what we do. So that now we just place this last amount and we massage a little bit. Now look at the difference, okay? This is like an implant. You see it's contouring this area. The fibrils of this scaffold form a matrix to blend into not only the skin, but the muscle. Okay, now flex a little bit so they can see. Go ahead a little bit more. There. So you guys can see, look, the actual growth is going to be like an implant. This will become soft and smooth into the tissue. Go ahead and relax. And it will actually combine even with the muscle to help stimulate. So we do a little bit of massage and then we get them back to the gym, you guys. This is like a enhancer. It's like a legal steroid, basically, because this is stimulating that tissue to grow. We're now going to go to the other side, do the same thing so you guys can see the evenness. Give me that. I'm going to go to the other side now. All right, bring this. Flex for them here so they could see. Look at what's already been built. Insane. Like literally 2 inches in the biceps in like minutes, all with Alo Clay. All right, go and relax. And we can do this with fat, but I want to tell you something. The way in which this is compressed, the way in which it's um, the literally the most important factors that are in fat cells, it's actually almost better than fat itself, unless you use the fat in a very specific way. And what I mean by that is the fat itself sometimes be a little juicy. It could be a little bit thin.
Not predictable.
What? Not predictable when it's right for survivability. And so with this, it's much more predictable. We get probably a lot more longevity. We don't know yet, but most likely. And with the fact that he works out, he's got peptides, and he's following, our Recodex treatments, he will get an amazing outcome. And look, within minutes, minimal bruising, minimal swelling, that's it. And that's Alo Clay right here. We can use it for many different areas. We've done it for penis, we've done it for buttock, we've done it for chest, we've done it for biceps. Literally one insertion point here, minimal bruising, and I want him back at the gym in minutes, basically. No, like the next day. Flex again. I want to take a look at the smoothness. I think it's great. You guys see, look, right along that bicep borders, absolutely perfect in shaping. He's gonna be so happy. Go ahead and relax a sec. Perfect. And with the right massaging and the right areas, it blends. Now we're doing it in a really unique way. We're combining it with other fillers. We're combining it with growth factors and peptides like CJC, IGF-1, even PDRN, all to help the survivability. And we're getting amazing results, but all off label, not something that this was designed for. So you guys, I'm just showing you something new that no one's ever done before. First, seen here, even though we've been doing it a long time, you can't even go to Korea for this. Okay. This is done here. We're in Manhattan today. We will get some great pictures of him in follow up, but that's Alo Clay for muscular building. Oh my God. It's amazing. I breathe.